in our team, and it's called a practical approach to advanced terminology services in health information systems. This is a summary. We are going to see some introduction to vocabulary control and some background analysis for terminology system development, the terminology software development, some functions and regulations. Recently, vocabulary control in medical informatics implied the selection of the most appropriate classification for a specific clinical scenario. This being reliable for epidemiological description of reality for billing purposes of chronic disease detection. But as medical informatics evolves, health information system needs to store information not only for user interpretation, but also for advanced computer knowledge management rules. That is why the current fields are designed to link all levels of care, like nursing stations, intensive care units, or inpatient or outpatient levels. And vocabulary control in this setting gets really complicated. There is a need of control tools, vocabulary control tools that map serve all settings and provide the adequate level of detail to each one for improving quality of care. Because clinical information systems must link clinical information with the clinical rules. Then there's a strict vocabulary control need. The old classification-based calling systems commonly used in electronic health records fail to provide this intersetting validity. They don't have the granularity needed for each level of care. And also are unsuitable for linking knowledge rules for clinical decision support systems. That's why advanced knowledge representation systems are needed. There are some examples like those used in the Nebraska Medical Center or Kaiser Permanente of these advanced knowledge representation systems. Schut and collaborators has outlined 3 functions required in a terminology system of 3 layers. These are the entry terminology layer. This is the user interface. Those are the terms used to interact with users during the data entry process. The reference terminology layer is the format used to store the data. The information knowledge should be stored in this layer. And the aggregate terminology. These are different data format outputs for user analysis. In this slide, I'm showing a triangle with the natural language is the base, it's the user vocabulary. Then, as an entry terminology in our system, we are using a thesaurus, and then we are using SNOMED CT as a reference vocabulary, and we have some aggregate terminology or output vocabulary. Like line, KTC, ICD-9. So SNOMED CT provides functionality in these 3 layers. It has descriptions that can be used as an entry terminology. We are not using the SNOMED descriptions, but it has these descriptions. It has all the functions needed for a reference terminology layer, and also it has standard cross mappings that can be used as the aggregate terminology. The purpose of this work was to describe the approach that Hospital Italiano de Buenos Aires has developed in order to build an advanced knowledge representation system with emphasis on data entry, storing, and extraction processes. Well, the Hospital Italiano de Buenos Aires is a 750-bed non-profit university hospital located in Buenos Aires, Argentina. 2.4 million outpatient visits and 36,000 hospitalizations every year. It has its own HMO with 150,000 patients, and since 1998 it has a full-scale HIS that has been gradually implemented, including outpatient and inpatient electronic health record, administrative pharmacy and scheduling systems, among others. Several standards were used, like those seen on the slide, and to uniform data collection, we moved our previous classification-based medical record into new terminology systems around SNOMED CT using HL7 common terminology servers. So there were two software developed. The first one is what we call the terminology server, that is a set of software services, web services, to provide access to the new terminology system to all existing applications in HIS. In this slide we can see that all our systems, like the report system, outpatient electronic health record, the chronic disease detection program, gets information from the terminology server. So vocabulary is controlled by the terminology server, and all systems use the same vocabulary. And we also developed terminology maintenance software. This was developed to administrate the institutional terminology, its relationships with SNOMED, and all the mappings. So